So the feeding tube is on the right side of the stomach, or right side of the body, right below the rib cage. It sticks out about 6 inches, and some patients are a little fearful of that because it sticks out, but it's a temporary tube. Once the area is healed, then they can replace that with something called a button, which is flush with the skin. We use the feeding tube for liquid formula, for hydration, water, liquid meds, crushed meds that can be mixed with water. So if patients are having difficulty swallowing pills, they can still use it for that. Even though they're still eating, maybe they have large pills that are hard to swallow, they can crush them and put them through. Some patients choose to puree foods. We always have the dietitian involved because there are different consistencies that always don't go down a feeding tube. So we want to make sure that the patient is aware of what can and cannot go down so that it's still remaining viable for them to use. And then we also talk about ways to feed, very different methods. They can bolus a feeding, which is a syringe and putting food in that formula. They can use a gravity bag that hangs overnight. They can use a feeding pump. It's very individual for each patient. There are specific formulas out there for vegans and patients that are lactose intolerant and things like that. So you can have a customized plan for any kind of lifestyle or dietary requirement that you need.